Hello, hello, everyone. Welcome to this space. Please drop in the chat where you're joining us from. We want to just remind you that the chat is for the session only. The event feed is for all of AirMeet that everyone will see. And the Q&A is where you can leave questions for our presenters. We're so happy that you are here with us. We know AirMeet is a new platform for all of us, so please, if you have any technical issues or questions, you can DM myself. My name is Bridget Okayo, or you can DM Yasmina or Carrie. If you go to messages at the top, you can type in a person's name, or you can find them and hover over it and send a message. We'd like to remind everyone of our commitment to maintaining a safe and accountable space. If you have any issues with any kind of person or a message that you think is just unfit for what we are doing here, please, please, please hover over that message and report it. And one of our team members will pull that person aside and say, hey, what's really going on? Um, I'd like to introduce our speakers here today. We have Neil Horn, who is a clinical child psychologist who has focused on community based work for the last 15 years, give or take. He's a co director of Intech and is also the director of several TA centers at Georgetown University's Center for Child and Human Development. Dr. Horn has worked closely with numerous states, tribes, territories, and communities in supporting their development of systems of care for young children and their families. And then we have Michael Roveres, who's an Intech team member from Georgetown University as well. He is a licensed clinical social worker with over 25 years experience, also give or take, working in national, international, state, and local areas, conducting trainings and consultations in over 40 states, 5 countries, and 20 military installations. He specializes in mental health and responses to community disasters, post traumatic stress disorders, and working with veterans and their families. I know today we are talking about a very, very heavy topic. So I want to remind you all to take a step back if you need to, visit our wellness room if you need to. Please take care of yourselves with this topic. I will turn it over to Neil and Mike.
Thanks so much, Bridget. I appreciate you making me sound younger than I really am. So welcome everybody. We're super excited that you're willing to join us. This was sort of a late breaking edition, session wise, that Michael and I thought, just given what's been going on, and just sort of most recently in Texas, but obviously just pick a state, pick a community, pick a whatever. We thought we would just offer a space. So we're not presenting. We're not here to sort of figure out gun control legislation. We're here to sort of facilitate a discussion. So this is more interactive. I really want you to participate. I think that for us, we're a federally funded technical assistance center. So we have funds that we are to use to try and help states, tribes, territories, communities work on policy. And I think that that's one of the things we can discuss, to work on mental health. That seems to be the thing that everybody points to after tragedies like this. And just by sort of way of background, Michael and I have been involved in all kinds of emergencies and disaster responses from a mental health perspective for the last 25, maybe 30 years. Um, and so I encourage folks to use this forum as a place to talk about the things that have been on your mind. And and I are here to sort of help. We have some experience and just want to sort of see where folks are at. So, Michael.
Yes, thank you, Neil. And as Neil said, we've been doing this and our paths have crossed in a number of places. And one of the things that you just said, Neil, is um, wondering how we can help. I think
Mm.
that's the question, that when these events happen and we are doing our due diligence in trying to create a system that not only is of care, but a system that cares for our citizens. it becomes a challenge a lot of times. And so um, the idea of talking about what we can do is really relevant for me today. I live less than 10 miles away from the latest mass shooting in Allen, Texas. And so it's ground zero. And one of the things that I will share that I see often is that people want to help. And there isn't really a a prescribed way to respond to community trauma. Each one is different, but each one has um, certain things that are similar. And for example, it's when a community tragedy happens, um, we try to organize to give responses, and so often we hear um, we're going to attend to the children, we're going to attend to the families, but one of the things I've learned is that it's often much bigger than that, and so and I've learned that some communities um, find incredible ways to help. And that's what we're here for, to discuss what are those things that are helpful in the wake of trauma. And, but also to remind everyone that the reactions that people have are normal. It's the events that precede them that are not. And so, how do we help people process that and help them understand that it's okay to feel vulnerable at times and to let those who care about you help? And so, those are some of the things that I would like to contribute, but as Neil said, we want this to be a conversation, and so please feel free to drop in the chat anything that you feel is that you may want to know about, um, or that you've done that you feel was a very good response to a situation.
The other way, Mike, just so that folks know, is you can raise your hand and you can actually, we can put you on the, apparently put you on the stage, if you will, and you can actually speak, which I obviously am a big fan of folks being able to actually talk instead of just using chat. But where do folks want to start?
With both of us being clinicians, there's that part of being able to allow space and embrace the silence. And so um, I was one of the MA mental health responders for Pulse, and one of the most meaningful intervention was a group that brought in about 20 dogs.
Mm.
Um, you know, I was at the scene yesterday or Monday, and there were about 8 dogs there, and I'm not sure exactly how they were used, but I can tell you from the standpoint of the people that were there who were just trying to figure out how they can help. Um, it was helpful for them. And that's the thing that I think we need to understand is how do we allow people to help? I see that we have Anne, and so Anne, please feel free to chime in.
Hi. So I got the stage invite, but I just wanted to comment on the dogs. I think it was Lutheran Services that came in. And so I think a really good idea would for that modality to be used in a broader perspective. Because I will tell you, not only did it change the atmosphere for the families that were there, the survivors, but also the responders. We were able to just kind of step out of what we were doing and go, love on a golden lab, which, right, give you a lot of love. So,
Yeah.
um, but one of the other strategies that was utilized in our county is the city and the county put together for about 2 weeks a broad-based place for families and survivors to come and get resources, so they could get
Mm.
plane tickets and hotel rooms and food and apply for insurance and assistance for utilities and things like that. So it was a pretty I mean, there were some mistakes made at the front door, just from my perspective, like the organization, nobody's really prepared, but it took probably a good, I would say maybe 5 or 6 days. But things kind of came together really, really quickly. So I just wanted to share that. Thank you for letting me share.
Super, super helpful. And you said something that really struck me and that I encourage folks to think about is how many of you actually know what the emergency plan is in your community. I spend a lot of time doing this for the Office of Head Start, working with Head Start programs, and I'm always struck by how few people have actually are made aware of this. And as mental health folks, this is a big piece of our work. So I'm wondering if any folks know about their emergency preparedness plans. Michael, there's a question from Shirley in the chat. How is the impact of the incident in Texas being addressed on the community level? Often the families that lost loved one and survivors offered assistance, resources, but what about those that are affected by the ripple effect in communities?
I don't know if she's Shirley can read minds. Mine is a very simple read if she can. But as I was listening to Ann, I was thinking about um, what happens after the media leaves and after the it kind of something else replaces it, like unfortunately perhaps another mass tragedy. And so being here in Texas, I've got to say that I'm fairly new here, but I do know that what they've done is they've instituted a community response at a youth center. I mean, at a senior center, and so it's not far from the outlet malls, and it's open to right now anyone who is who feels that they need to process that. And again, one of the things I think that we often do a good job of is we are able to talk about, well, how do you talk to children about this? But the reality is that when we think about how we talk to children about it, it's having a well-informed adult who understands the importance of demonstrating calm, of being able to identify people who are doing good work, to help create a narrative for the child that, yes, this bad thing happened, but here are the things that we are doing to move forward. And the world is indeed a safe place more often than not. And so, as a long-term plan, again, I'm new, but I know that several of the hospitals, Children's Hospital of Dallas, they have set aside their therapists to be available for those on a walk-in basis, and there are no fees for that. I have seen where there are sliding fees for those who may not have insurance but may need longer treatment, and so it's a mixed bag, if you will. It's a bag that is not um, that has been coordinated by uh, the city of Allen, and that's where it's resting.
Okay. Thank you.
Oh,
Yeah.
thank you for asking that question. And thank you for reading my mind. It's such
Like minds think a lot.
yeah, let's go with that.
Yeah.
Yeah. Thank you so much.
Thank you.
Shirley's question brings up an interesting point, and it's one of the ways in which Michael and I have crossed paths. Is after Hurricane Katrina, as those of us who are who've more mature, like Michael and I, may remember, is a number of folks ended up in Texas, and so I was sent to Austin, Texas, where 8,200 people were living in the Civic Center. And one of the issues that came up to your question, Shirley, was we have a waiting list in Austin, Texas for some services. Where do these new people come in terms of our waiting list for our services? If we're building a system, and Austin had actually been doing some fantastic work, Francisca Tad and others there, how do we deal with some of those sorts of issues that we now have folks who may need to sort of get into services immediately. And I think Michael's description of what's happening in Allen is a great example. To Ann's point around, people scramble, and oftentimes in those first few days, there's just people trying to figure out sort of how do we set this all up. So,
Yeah,
um,
absolutely. And I think part of it is about maintaining the commitment, because it is so easy to be distracted as an organization by returning to what you were doing. I mean, and that's quite honestly the way funding works, is that many of us are funded to do a certain thing, and we get a sense of grace from our funders to pivot to take care of those who are impacted by this, by the tragedy and the trauma. But then we have to get back to what our original vision and mission are, and it is a challenge, but I think part of it is being able to bake into your original mission and vision an idea of that if we are visited by disaster or community violence, what is the plan?
Jerry wrote, I work as a peer support supervisor at an outpatient mental health organization, and not only are mental health crises being experienced by the community members, but mental health providers as well. It's very stressful, always on high alert. We recently
And,
had a mass shooter training in our mental health facility due to all the recent mass shootings. How are those working in mental health to be supported?
well, I think it's something that should always be a priority. I remember when I was working in New Orleans, and I had a friend who was we got our masters together, and he was a funeral director, and he asked me what at the time I thought was a strange question. He said, "How do you do that work?" And I was like, "Carl, you're an undertaker. How do you do your work?" And he said, "Well, I take care of families. I take care of the physical body, and a week later, it's gone. But what you're doing is revisiting over and over again what people have experienced, and that has to be painful. And that's part of the work of people who are treating people for trauma, is that being able to bear witness and hold a place for those who are impacted in hearing and having those groundhog days, if you will, of repeating, of hearing the story and the graphic details repeated. I mean, I can't, I'm just thinking about since Saturday, how many times I've heard descriptors of what these AR style weapons do, and I've seen it, and I know what it looks like, but it's a weight. And so, Jerry, your question about how do we take care of those who are responding is a critical component of building a successful response team. Is that you have to be able to allow for those people who are doing that work to have an opportunity, not just for supervision and processing, but also for grace. And that is, I think, just one of the things that when we think about how we train people, we need to get perhaps a little bit better at, is helping people understand how trauma, being trauma informed is one thing, but really emphasizing the impact of trauma on the compassion, on the healer.
Okay, thank you for that. Can you hear me?
Yeah.
Yes.
Okay, yeah, thank you for that. I thought, that it was good to bring that up because in the chat I had also put of where I'm from. Um,
Hmm.
and so I'm not a stranger to um, a lot of violence going on. I live in the city of Compton, California. And we have a lot that just goes on here, just in, where I live in the community. And the mental health facility that I work at recently, not only when I mentioned about not only the community experiencing mental health triggers issues, it's also been staff members. I mean, and it's been happening more, a lot where we've actually had to go on lockdown, stay
Hmm.
away from the building, and we've had all these emergency crisis trainings, It's just been a lot more recently, like within the past month, I want to say. And just recently had a uh, mass shooter training where some of the FBI members came into our facility, and over 200 of us were, part of that training. And it's really just to speak for me personally, for me to now be in my office at work and really be, keep my door locked and keep my shades uh closed where anybody can, walk by if my window is open, where, maybe some of the mental health patients might, have access to walking in the breezeway, and where my window is, and my ears, are more alert to listening if somebody is, having a hard time in a crisis, hollering, screaming, and really trying to be alert. And it can be stressful,
Mhm.
um just to try to, to try to be alert,
Mhm.
and keep your ears in tune, and while you're working at the same time. And as a person with lived experience, who is also a supervisor, and also dealing with, supervision with people with lived experience, and dealing with different triggers, and all of those things, it's very stressful. So that is why I just wanted to, comment on that. And um I don't know.
No,
I just, yeah.
it's a lot, Jerry. And
Mhm.
when you're speaking it, um, I'll start by just saying, as mental health folks, we have to first start by just saying how hard it must be.
Mhm.
Hmm.
I remember the first time I went, we had teams after Hurricane Katrina, and we were doing, like everybody, 16-hour days. And then we had to have a call at 11 o'clock. We had two people who were like our check in people. And 11 o'clock every night, we had to have a check in. I was like, oh my God, I don't want, it was the best thing I ever had, was
Hmm.
to have someone to talk to, because of how
Right.
stressful it was
Mhm.
to have to deal with the kinds of things that we were dealing with as the mental health folks. And so now, anytime, every hurricane since then, every tornado, flooding, I was working with folks in Uvalde, every single one of those, I have somebody that I'm checking in with so that I
Hmm.
have a release. And I think, I don't know how, as mental health folks, we can expect anyone to deal with that,
Hmm.
particularly us. We're not sponges. We're
Right.
right. And what you're describing,
Hmm.
your experience, is something we need to be more cognizant about. That just because you're a mental health person doesn't mean that you can just absorb unlimited amounts of some kind of
Exactly.
trauma. And I
Absolutely.
Hmm.
about workforce. If we want to have a good workforce, we need to take care of our workforce.
Yeah.
Right. Hmm. Thank you so much for that.
Yeah, Jerry.
Neil, that reminds me of the work that I still do. And people ask, how do you support someone who has just been at the ground responding to a community trauma? And what I will say is this: is that um, there are people. It's not like supervision. You don't have those calls that you described to to make sure that you did the right thing. What you have those calls for is to be able to give voice to, I need to let this out.
Yeah.
I need to, I just need to say what I just bore witness to. And as someone who is on the other end of that, it's not to say, well, that's very good, but perhaps you should consider. No, that's not it. It's like, you know, that is difficult. And one of the things about it is that you and I know that we both have done this work long enough where you can just lay it out there, and you know that I understand. We tell people all the time not to say I know how you feel, but there is a sense of being part of that fraternity or sorority that has unfortunately had to address this and be there for others. And so being able to give that support to your colleagues at 2 in the morning, at when they call and say I was just at a shooting or something, and I just need this time is really important. And that's what I have always tried to bake into programming, that if I'm a lead on or a director, is to make sure that if you have a call, if you go somewhere, you have to, before you lay your head on a pillow at night, check in with someone.
Bridget, did you want to jump in?
Yes, I'm bringing my own self on the stage.
Nice.
I wanted to circle back to a comment that Michael made about how we have to, tell our children and our young people that this isn't normal. Like what's happening isn't normal. The world at large, this isn't happening. But also, a lot of children today, this is normal. Like this is constant over and over. So, what would you say to young people who are constantly bombarded with on social media, another shooting, or, they watch the news, another shooting? How do they either not become just so incredibly angry, like I am all the time? Shout out to Jan for helping with that. Or becoming jaded and not having any faith in community and faith in the government, where you're not really seeing that change happen. You only see the bad things happen over and over again.
It's good. It's a good question.
Yeah.
I'll answer from a personal perspective, right? We're in a discussion. This is not like, and I think when Michael and I thought about this discussion, one of the things that we tried to emphasize is it's not like we have an answer, right? It's not like we actually, if we knew an answer, we would have been. But I think one of the things that I've been struck by is that there are people who take action. It's really struck after what happened at Marjorie Stoneman Douglas, how those young people did not just sit and take it. And I live in Florida, and thought about, like, here are some people who are like, we're not just going to sit around. Like, we are going to become advocates. And it's in some ways, it's awful to think that one way in which someone becomes an advocate, but in our world, I think many of us are familiar with this, is by going through some unbelievable tragedy, stress, or trauma, whatever it is. So I think, Bridget, to your question, I think one thing to think about is what are the things you can do? So what we know about just stress and anxiety in general is that when you're trying to deal with things that are out of your control, that's what sort of jacks that up. When you think about the things that are in your control, that can help. So I watch how some people, we saw this after Newtown, some of those parents in Connecticut who've become some of the leaders in this country around sort of forcing folks to address things. The other piece for me is like just acknowledging that this is happening, talking with children and youth in a realistic, developmentally appropriate, and honest way. And the truth is I have a 7-year-old who is very well versed in active shooter drills. I was not. They pretended that if a nuclear bomb dropped on my elementary school, that my desk would protect me. That's how old I am. But there are people 5 and in fact, I just finished writing guidance on active shooter drills for infants and toddlers for early care and education programs. I never thought I'd have to write that. I think, Bridget, part of this is thinking about what we can do. And I'd be interested to hear what other folks are, where they're at, given that this is something that, truth is I'm not going to do it, but I wouldn't be shocked if every single person here is no more than 2 steps removed from some unspeakable tragedy like this.
I will also add, Bridget, and if anyone has a comment, please feel free. But I think it's worth reminding ourselves that when we think about young children, it's always in the context of a relationship. And so when you feel, where can I turn to think about the response, think about the relationship, and the relationships that, not just your relationship, but other relationships that that child might have, that you can, in a sense, build around a system of support for that child. And so what Neil said is absolutely spot on. I mean, but he's done this enough that, and that's what they pay us for, is to do this work. But at the same time, being able to share with parents, aunts, uncles, community members, that custodians, cafeteria ladies, that you are absolutely important in a child's life, and so and you are also impacted when those children are hurt. And how can you not be? So um, having to look at the big picture, and then ensuring that those people that are a part of that big picture for that child understand that they too have a voice. And as Neil said, the ability to change the narrative from "this has happened to us, now this is what we are going to do." And I really think that um, being able to provide those venues, we, as part of system of care on a regular basis, talk about parent and youth voice. Well, the ability to be able to support and shepherd that process so that there is a voice to make to share that with community leaders is really important, and perhaps this is a place where we can do that. And so, Neil, you and I have been doing this for many years, and as you think about how systems of care have changed in the ability to, uh, I mean, have you seen systems addressing, as part of perhaps their applications, um, including a response to community violence? Or um, I'm just wondering if over
Yeah,
the years, have you seen things that communities have done in applications, and also in the execution of what they said they were going to do, that addresses community violence or
well,
trauma?
I guess for me, it's a distinction between community violence, which, as Jerry spoke to and others have mentioned, is something that has an impact on a number of folks across the country, versus I think the more narrow thing that we've been talking about, like a mass shooting event
Mhm.
like this. I think any number of folks across the country, and I'm sure there's folks here who have sort of been trying to address that in their systems development efforts and put in an application, or just sort of in their systems development. I think this is a more unique piece, which is it's not just community violence, it's this specific type of community violence. And as Pat says, like, that when folks I think are experiencing some frustration, that there's some platitudes that get tossed around like thoughts and prayers rather than real policy change. And I think that's the challenge for us as we're building systems. It's not just about the services and supports, right? It's about
Mhm.
policy change that makes things more youth and family driven, less racist, quite honestly, if we're being honest about how some systems operate. Um, that those are things that are policy changes, and policy is a very challenging aspect of systems development, because we have elected officials who may have lots of different concerns and constituencies and things that they're trying to balance, which I know for some feels like, well, that doesn't make any sense. No one's for this kind of thing. And I think that, Dia, I'd be interested to hear. One of the things that I'm hearing from folks across the country is that they are doing more of the sort of preparedness training for active shooters, and I'm hearing some real horror stories about um, people coming in sort of very just sort of over the top law enforcement military style. I'm seeing this um, in in early care and education. They're trying to do this. So I'd be interested to hear things that have worked for folks. things where you're like, oh, we've been through a training, or we have a great plan, or those kinds of things.
Yeah.
And I see Dee sort of mentioning that too. Like, how do we safely bring that information to families and students while protecting the innocence of our children? So, Dee, I love that we are trying to let people be anonymous and put things in chat, and then forcing them to get on screen, make sure they're okay, and talk. Welcome to the club, Dee.
Hey, thanks for that. Yeah, actually, my experience, it was as a, Navy Command Ombudsman, and it was through the installation itself under my capacity as an ombudsman. So this wasn't, I wouldn't be an individual responding to an active shooter situation, but just knowing this could occur. And because we're military connected, there's always a concern that things are going to go in the wrong direction, shall we say. But through that, it was more of a 1 hour training. It was lecture based, and it was talking about procedure and the drill and how you would respond to it. How can we carry over that information in a safe way? And by safe, I don't just mean physically safe. I mean without completely tearing away that false, at times, sense of security that we have in our communities. And how do we apply that to our children without traumatizing them in the same sense of nuclear reaction drills, and things like that? How do we safely train to get behind something, to lock the door, to try to think through the impairment of the emotions of that moment and react in a way that's going to ensure your safety and those around you? That's the struggle that I'm seeing. I've seen it done, and I think it's effective. And then I'm hearing about the more intensive drills that are going on, where you do have an experience as though this is happening. The very nice lady talking earlier about the FBI's involvement and the event at the mental health facility. But how do we do this on a reduced scale that's still safe and still effective to train to respond in a moment when your emotions are going to betray you?
You trying to wait me out, Roveris? What's happening?
Yeah, I am. And you blinked, so.
No. That's Well, you've got me before. No, I mean, Dee, I think it's a really important thing to think about. Right, we're moving to a place where I think, if I'm being honest, if you asked anybody from like 9th grade up, they've been around long enough that they've probably been through a drill at some point in their school life. And sort of, for me, one piece is I'm really big on emergency preparedness. To know if something happens, you actually know what you're supposed to do.
Mm-hmm.
Ranging from, given where all of you, I've been looking at folks who are here, ranging from I live in, Tornado Alley to I live in Florida where there's hurricanes. I mean, I think this is another thing that people have to be prepared for. And I think if we take it from a developmental perspective, we have to be honest that if you're in high school, if you're 18, 19, 20 years old, this is unavoidably in your world, the social media piece that Bridget brought up earlier and things like that. And I think that if a system can start to think about this from a more proactive, like, we don't want this to happen, but we want people to be prepared. And so we start with, in schools, what can we do? How do we help parents understand this? And this is, I think, it's just part of where we're at right now. But I think a lot more about preparedness and what's a good way to prepare. So there's a big difference between just ringing the fire bell and everybody just sort of going all over the place to, we're practicing a fire drill. So if there were a fire, and really laying out, this is a drill, we practice these things. I think practicing those things is really important, and helping people understand, what we're trying to do. We're trying to stay safe. And that is hopefully a concept that in many communities is not an unfamiliar concept just broadly. that we're trying to stay safe. So again, it's fine to drop a big question, D, because I think it's a question
Yeah.
that people are struggling with.
And, with that question, D, I think that it's somewhat of a third rail, but understanding the communities where we're living and what their feelings are about firearms and how you work that into what your programming it's a critical part. I remember when I was directing a system of care, a young kid whose dad was um, in the Middle East, who was an MP. His picture of him was with an AR weapon, and so this kid wanted to bring his toy gun to the child care center, and it really upset a lot of the teachers. And so it came to my team, and we were like, and I have a brother who was a drill instructor at the time, and I talked to him, and he said, have him check the weapon on military installations. If people have weapons, they check them. That, and it's good that this kid that's part of the military culture. And I was like, yeah. And so they went through this whole thing of being more like dad, and to allow this child to be able to do that. And so my point is that um, communities, military communities, but also rural communities where firearms are a part of the culture and history, we need to understand that. But the other part is that, we don't want, so when we're talking with those children, the children who live in those communities, the hope is that they have an understanding, that parents and the adults have an understanding of how to do that. And that these acts that are just so horrific and random or planned out to hurt people just because, completely different things, but at the same time, we need to understand the community and and what words we use when we talk about when we thought about how do we uh, do this presentation. Part of the conversation was about, well, we're not, as Neil said, we're not going to prevent the violence, but we don't want to divide. We want to heal. We want to be able to bring people together, and that's part of the vision, that when you think about how you're responding, is that it does allow space for those who may have a different view to come into the conversation and come into the process of helping the community heal.
It's really interesting to me. Just, I'm a psychologist, so I just note things and then I make you pay for 6 sessions instead of just answering. Is we haven't talked about the people who've perpetuated these things and what leads somebody to feel so, wherever they get, that seems to be an answer. And while I'm not sure that just everyone running around saying it's mental health is completely the answer, it always strikes me when I think about what leads somebody to that point, that seems like the thing to do. And you do read in some cases that somebody's been in contact with our systems. And I wonder what's happening. And it's not necessarily a fail. I wouldn't say the word failure, but it always strikes me, as much as I think about, everybody who's been impacted, that there is a person who got to some point that made a choice that is so, I think, foreign for me, and for many others, as like that seems like a choice to be made. But I just wondering where folks are at with that, and what folks are doing in their communities, and what the conversation is in their communities. Because I see in the chat things about where the country's at, and things that I think are really, many of us are wrestling with, that I think resonates for a lot of us.
Well, Neil, like the work that we do, this conversation is not as easy as we. It's like it seemed like a good idea at the time, and I'm glad that we were able to have this conversation. And I think part of what I would like to do to acknowledge is that to a degree it is about shining a spotlight on something that we often don't want to have to talk about, but here we are. And my personal hope is that as you um, um, listen to what we have to say, but also when you leave, you have thoughts about, yeah, we really need to uh, consider how prepared we are, and um, and I think that's one of the big takeaways that I would like is that it's about preparation, but it's also about helping others understand that it's about giving grace. It's about allowing those who want to help to find a place for them to help. And yeah, it's this is a heavy topic. It's not easy. There's no getting around that. But as Neil said, we're federally funded, and it's to a degree we're here. There's no strange or bad question. It's as a system, as a person looking for resources, we're here for that, and that's not an advertisement. It's just what we do. And I would hope that as you navigate the different sessions, and perhaps you may connect with someone from another site, um, build those relationships. You may hear someone say something that you're like, what, this is really um, something that I'd like to learn more about. We're very hopeful that you can jump into the different rooms to make those connections.
I'll sort of throw this out for folks. Just I was down in Uvalde weekend, weekend before, I don't remember, last couple of weeks, and have been working with folks in the community since the shooting. And one of the things that has struck me over this past, I think this week or next week will be a year, is this idea around tragedy to healing, which sort of, I guess when we wrote it, was like corny, but the idea that there's some healing in this community that has to happen, and I think that happens after a hurricane, after a tornado. There's healing. This is a completely preventable sort of thing, um, at least theoretically. And what I've been struck by in that community is that this entire year, from the from the day after that shooting, it's not about what they can do. What can we do to support children and families in this community? What can we do? And I mentioned that to it's so funny because I was there, and they had a community fair. I don't remember what sort of how to best to describe it, but I was working some booth where like the children would come and they play a little game and get a little pie, whatever it was. And the staff that I've been working with over the past year kept coming over like, "You okay? Do you need something?" I kept thinking, why are they trying to take care of me? I don't live here. I didn't experience this. And it was just a sense of like, we are in charge of healing. And they've really sort of taken that as, so our job is to help our children and families feel as safe as we can, right? As many of you have mentioned, like I live there and it's always on the forefront of mind as parents, like Kendra said. But the idea of like, can there be healing? Is there a facet to our system, in our community, in our territory, state, tribal nation, whatever it is, that is about sort of taking a horrible thing and figuring out what we can do to take another step forward, which is often, and as those of you, Michael, and others who are close to Alan know, those first steps are really hard. There's a lot of steps, a lot of directions, and so, um, just a thought that I thought I'd share with you, that there is some healing potentially to be done after these things happen that may not feel like you're getting very far. And I see all the frustration in the chat. And the idea of like, what are people doing has really, it struck me in New Jersey after Hurricane Sandy, and Puerto Rico, Virgin Islands after Maria and Irma, and earthquakes in Ponce and stuff. Just sort of strikes me about what people do to heal.
You know, this is not a clinical strategy. It's not anything that, but what you described, Neil, is the power of being present. And I would suspect that those children that you interacted with were given the gift of having a moment with an adult who is there just to be there and to be crazy about them, if you will, to enjoy them and to help them enjoy the moment. And that is, I really think that even as parents, people who have these letters behind our names and we study this, we talk about it, but I'm struck by how many times I thought I missed the um, the opportunity to do something with my child, and then years later they've come back and said, "Remember when this happened and my permission slip wasn't signed, but you took the day off to do this?" And then it's like, that was one of the best days of my life. And you're like, I felt like I was falling behind, but I was there. And so when we think about those things where we are able to bring in the therapy dogs, or we're just able to check in and have a moment with a child or with an adult who is working with a child, and being able to be present, to listen to them, to bear witness to their pain, and to support them. We may not think much about that, but you got to know that so often, so much more often than not, those are the moments that people, when they start talking about what helped me heal, was I shared a sandwich with some guy who was there to help. And that guy could have been a therapist. He wasn't looking at what was going on through a clinical lens. He was just being there. And so um, when we think about, um, I know we're talking about having a response, being planful, but the reality is it's also about being there. And I will say this, not just being a voyeur of someone who can go because it's happened, and engage people, listen to their stories, acknowledge what they've gone through, give them that opportunity just to let it out. And then to have, for those of you who are with people who are doing that, the next row is to be able to say, hey, you just went down to Uvalde. You were just doing this work. Check in. How are you doing? Let's, what's going on? And it's what, it's a way of supporting people that just, I think, means more than you'll ever know. It's just that it's not a clinical thing. It's not a studied thing. It is down to that very basic human experience of supporting one another.
Yeah, I think a lot of this is mental health walking around.
Right.
That's really what this work is. Mental health walking around is not necessarily what we were all trained to do, as many of us are mental health folks. I just think sometimes just sitting.
Yeah.
Jerry Paul. So Michael and I happen to be on the early childhood side of the house here, but Jerry Paul, a big infant mental health specialist, has this quote that I'll mangle, but it goes something like, "Don't just do something, stand there." The idea of like, stop, just be. It's okay. Sometimes just being, and not, you don't have to have an answer. And I think I appreciate Pat acknowledging like there's not an answer here. We haven't been waiting until the very bitter end to now break out a PowerPoint with exactly what to do. Like, there's a space for y'all to talk with one another. And sort of share and hear about things that are going on. And as was pointed out earlier, those person connect with them this week, chat with them. So
Right.
we appreciate everybody coming here. We know that we have lots of choices in the summit, and that you all chose to come here for whatever reason you chose to come here. And for us, it was just a space at this point when these things are happening. And again, as I said, I can't imagine that any of us are too far removed from it happening either in your community or to someone you know that you're close with. We really appreciate it. There's a survey to fill out that I would love to tell you how to go find it, but I like to keep it secret and let others have a chance. I'm going to let Bridget explain just how the kind of giver that I am, Bridget, that I allow you the opportunity. But Bridget, anything you want to say to sort of close this out?
Yes, thank you so much, Neil and Michael. Thank you for holding this space with us and answering questions, even my burning questions. I appreciate it so, so much. To everyone in the session that has stuck with us, thank you again for being here. Again, please take the time you need. This is a very heavy topic. If you need to go pet your dog or your cat or parrot, whatever kind of pet you have, or what you have around you to lessen your anxiety, please take care of yourselves. We are very, 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 very happy that you decided to join us today. The survey is on the panel with your chat and your Q&A. The second icon from the bottom, it looks like a box with some check marks. That is where you can find the survey, and it should be pinned to the top of the chat. So please let us know how we can better serve you using that survey. We appreciate it so much. Our next session is going to be our next keynote. We're going to have Bethany Boyd, who will be sharing her experience, strength, and hope as a young person living with schizophrenia. So please take a few moments to yourself and then join us for our next keynote. Anything else from Neil and Michael?
No.
Thank you
Keep
all
up the good
so
work.
much.
Yeah.
We'll see you
Thank you.
soon.